Hello, my name's Jen and today we'll be talking about inhibitory techniques used in corrective exercise. Inhibitory techniques are a great method to decrease overall activity of neuromyofascial tissue. More specifically, SMR, or self-myofascial release, is a primary technique used to alleviate tension along a muscle. This is essential as personal trainers to know when training and treating clients. As personal trainers, when conducting SMR, it is very important that we understand how poor posture and repetitive movements can create movement dysfunctions within the human movement system. When muscles are used, thus increasing tension, the muscle creates a microspasm. This spasm then creates knots or trigger points within the soft tissue. As a result, the muscles begin to have altered length-tension relationships, and this is how we see movement imbalances. There are many different tools that can be used. Rollers with different penetration levels, balls, handheld rollers, instruments assisted, and vibration and percussion devices that can all be used to alleviate these microspasms and trigger point dysfunctions. SMR should be avoided for those with chronic heart failure, kidney failure, or any organ failure, bleeding disorders, and contagious skin conditions. SMR can be used on a daily basis. One should hold the foam roller over areas of tension for roughly 30 seconds for maximal pain and 90 for lower intensity before moving on. If there is no pain, simply move on. The first SMR exercise we're going to do is the latissimus dorsi. This would be a great exercise for us as trainers to use on clients struggling with forward rolled shoulders. So what we want to do is we want to start in the side lying position with an arm outstretched and the thumb pointing upward. You want to place the foam roller just under the armpit. Slowly move back and forth until tender area is found. Once found, hold until the discomfort is reduced, which is about 30 seconds, and then continue on to the next tender spot. You want to ensure that the body remains in line while drawing in, so bringing those abdominals to the spine. The second SMR exercise is going to be for the gastrocnemius, or the calves. I find this to be a common area of pain, and thus it would be effective for all our clients. Begin by sitting on the bum and adjusting the foam roller just below the calf area. An individual can either support and lift their body via the arms, or if they're unable to do that, can increase the tension by crossing one leg over the other while staying seated. If this still doesn't work, the individual may need to be assisted via another individual or a trainer like us by placing pressure on the point of pain while staying seated. Begin slowly by rolling over the calf area to find the most tender spot. Once located, stop rolling and rest on the tender area for about 30 seconds. While rolling, we want to ensure that the proper posture is maintained. So having a neutral back, having the shoulders back, an upright position, and the belly is drawn to the spine. Next, the SMR exercise is going to target the trigger points within the adductors, which is perfect for individuals with valgus knees. So if we see in those postural assessments or movement assessments that the knees come in, this would be a great exercise for that. We want to begin by extending the thigh and placing the foam roller just under the groin region, lying with the belly on the floor. Once finding a tender area, you want to hold for 30 seconds or 90 seconds depending on pain tolerance. If they're finding this too easy, they can attempt to straighten the leg, which should increase tension. You want to ensure the body remains in a plank or neutral position with elevation at the elbows and ensure that the core remains tight throughout this entire movement. Lastly, here we see the myofascial release technique for the piriformis. I find that with my own clients that nearly everyone is tight here without them even realizing it sometimes. You want to begin by sitting on the foam roller. Bring one knee to 90 degrees and cross the other leg over top. If this is too difficult, they can straighten the bent knee just a bit. Next, we want to roll slightly towards the crossed leg while grabbing the knee with the opposite arm. You want to find the area of tension and hold for about 30 seconds, and once that pressure is alleviated, move on. You want to keep the body in the upright and neutral position while drawing the belly button to the spine.